With retirement age at 67 right now, and most people starting a career in their mid to late 20s, that means there's about 40 plus years to have in the working world. So, having the ideal job plays a huge role. That's why the job I would like to have is that of a physician assistant or a PA. The first reason, I am already a nurse. So, with my nursing background, going back to school to obtain a master's to be a physician assistant would be building upon the knowledge of healthcare that I already have. That, in combination with management experience that I have in nursing, makes it the ideal role for a provider as far as seeing patients, making decisions based off of diagnoses and lab results. I feel like being a nurse kind of gives me a leg up as far as wanting to be a physician assistant. Reason number two is versatility in healthcare. As being a physician assistant, you can jump around to different specialties. You don't have to just stay in family medicine or stay in the operating room. You can go to psych, you can go to med surg, you can go to ICU, trauma. It just kind of depends on your interest and what you want to learn and how far you want to take it. Also, it gives you a freedom to choose. Sometimes people don't like the hospital setting. You can choose the urgent care setting, or you can choose the long term care facility setting, even outpatient setting. There's different settings that you can choose and don't have to necessarily be tied down to one specific place. The third reason why I would like to have a job as a physician assistant is because as of right now, there is a 38% increase in the job market for physician assistants. So this means job security, which in you're thinking 40 plus maybe 50 years of having a career, job security is one of the things that you want to look at. All 50 states, even different countries in like the UK and China, utilize physician assistants. So even if I didn't want to stay in Texas, I could move, somewhere in the Northwest or the Northeast, or even go over to the UK, and I would still have a job as a physician assistant. Also, it allows me to give back to the community. Most PAs, when they're in school, they go through community service, and that even carries over after you've graduated and been certified to work for different medical relief charities, volunteer in underdeserved areas, just making a bigger impact in in the community. That is one of the things that being in healthcare, whether it's a nurse or a physician assistant, that we cherish. So, in giving back and being already a nurse and having versatility, these are big reasons as to why I feel that I would like to have a job as a physician assistant.